Hello and welcome to this Tender Transitions production focusing on life-changing coaching using TBRI and ABA principles. I'll be your host, Nishoni Harvey. Are you a foster parent of a medically fragile child with unanswered questions or less than apt support? I coach foster parents on how to move their medically fragile foster child from trauma to triumph. Join me today to explore successfully parenting the medically fragile child. Hello, and welcome to this episode of Parenting the Medically Fragile Child with Coach Nishoni Harvey, CNA. So I want to talk about in this episode common conditions associated with medically fragile children. Caring for a medically fragile child is a profound responsibility that involves managing complex and often unpredictable health conditions. And these children, they face a variety of medical challenges that require specialized care and continuous medical oversight. And in this episode, we're going to explore some of the most common conditions associated with medically fragile children. And we're going to delve into their characteristics and the challenges they present and ways in which caregivers can support these young ones or these teenagers. First, I want to talk about congenital heart defects or CHDs. These are they are among the most common birth defects, and they affect nearly 1 in 100 newborns. And these defects can range from minor issues, such as small holes in the heart that can close up on their own, to severe abnormalities that require immediate surgery. And some of the most serious CHDs include hydroplastic left heart syndrome, transposition of the great arteries, and tetralogy of Fallot. And so children with congenital heart defects or CHDs, they may experience difficulty breathing, poor weight gain, and fatigue. And these often require frequent monitoring by a pediatric cardiologist. And some may need multiple surgeries over their lifetime. But despite these challenges, advances in medical technology have significantly improved the outcomes for these children with CHDs, and it allows them to lead healthy, active lives with appropriate care and intervention. So the next thing I want to talk about is respiratory disorders, and they're a major concern for medically fragile children because they can impact the ability to breathe independently. Conditions like chronic lung disease, severe asthma, cystic fibrosis, and bronchopulmonary dysplasia, or BPD, are particularly common in children born prematurely. And these disorders, they can necessitate the use of supplemental oxygen or ventilators or other respiratory support. Chronic lung disease, for instance, it often results from underdeveloped lungs in premature infants, and it leads to prolonged respiratory support needs. Cystic fibrosis, a genetic disorder, causes thick mucus to build up in the lungs and other organs, and it leads to frequent infections and respiratory complications. Caregivers of children with respiratory disorders, they have to be vigilant in monitoring their child's breathing and in responding quickly to signs of respiratory distress. Regular visits to pulmonary specialists and strict adherence to the treatment plans, these are crucial to managing these conditions effectively. The third thing I want to talk about is neurological disorders. They encompass a broad range of conditions that affect the brain, the spinal cord, and the nervous system. And in medically fragile children, these disorders often include things like cerebral palsy, epilepsy, spina bifida, and severe brain injuries. Cerebral palsy, or CP, is one of the most common neurological conditions in children, and it's characterized by motor dysfunction due to damage to the developing brain. Children with CP, they can experience muscle stiffness, tremors, and difficulty with coordination and balance. Depending on the severity, they may require physical therapy, occupational therapy, and assistive devices to improve mobility and quality of life. Epilepsy, another common neurological disorder, involves recurrent seizures that can vary in severity and frequency. Some children may have them only at night while they're sleeping, and some children may have them during the day. And there's also different kinds of epilepsy. But managing epilepsy in medically fragile children often requires careful monitoring of medications and close collaboration with neurologists to prevent and control these seizures. So the next thing is genetic disorders. These are caused by abnormalities in an individual's DNA, and they can result in a whole array of health challenges. Some of the most well-known genetic disorders in medically fragile children include Down syndrome, muscular dystrophy, and cystic fibrosis. Down syndrome is caused by an extra copy of the chromosome 21. So it's associated with intellectual disabilities, developmental delays, and a high risk of congenital heart defects and respiratory issues, which we've already covered earlier. So children with Down syndrome, they benefit from early intervention programs that focus on physical, occupational, and speech therapy to support their development. Muscular dystrophy, or MD, is a group of genetic disorders that lead to progressive muscle weakness and loss of muscle mass. And the most severe form, Duchenne muscular dystrophy, primarily affects boys and often requires intensive physical therapy, mobility aids, and the respiratory support as the disease progresses. Then there's premature birth complications. Premature birth is defined as birth before 37 weeks of gestation, and it's the leading cause of medically fragility in children. Premature infants are at a higher risk for a variety of complications due to the underdevelopment of vital organs such as lungs, heart, and brain. And these common complications of prematurity, they include respiratory distress syndrome, or RDS, intraventricular hemorrhaging, or IVH, and necrotizing enterocolitis, so NEC. So these conditions often require intensive care in a neonatal intensive care unit, or you might know it as a NICU, where the child can receive breathing support, medications, and specialized nutrition to support their growth and development. Even after leaving the NICU, many premature born children, they continue to face these challenges, or some challenges, including the developmental delays, feeding difficulties, and a heightened risk of infections. Early intervention services, if I can get it out, and ongoing medical care are essential to helping these children reach their full potential. And then, of course, in an earlier episode, when we covered the conditions of medically fragile children, we also spoke about cancer. So I want to dive a little more into that. Pediatric cancers, though relatively rare, are a significant cause of medical fragility in children. The most common type of childhood cancer includes leukemia, brain tumors, and neuroblastoma. The treatment of these cancers, such as chemotherapy, radiation, and surgery, can be extremely taxing on a child's body, and they often lead to weakened immune systems and other complications. Children undergoing cancer treatments, they require meticulous care to manage the side effects, prevent infection, and support their overall well-being. The emotional and physiological impact of cancer on both the child and the family is profound, and it necessitates a strong support system that includes medical professionals, counselors, and peer support groups. And don't forget that we at Tender Transitions, we offer support groups, we offer counseling. And so that's just some of the things that we offer. But the conditions described above, they represent just a few of the many challenges faced by medically fragile children. Each condition comes with its own set of complexities and requires a tailored approach to care that considers the child's unique needs. For families and caregivers, understanding these conditions and their implications is the first step toward providing the best possible care. By staying informed and seeking appropriate medical care and accessing support resources, caregivers can help medically fragile children lead fulfilling lives despite their health challenges. Thank you for tuning into this episode, and we will see you again next time.
Thank you for joining me today in this episode of Parenting the Medically Fragile Child with Nashoni Harvey. We coach foster parents on how to minister to the needs of their medically fragile child physically, emotionally, and spiritually so they can move them from trauma to triumph. If you're the foster parent of a medically fragile child, make Tender Transitions LLC your go-to resource. You can find us at www.medicallyfragilechild.com. We offer coaching, courses, training, and free resources to the medically fragile community. Join us next time on our next episode of Parenting the Medically Fragile Child so you too can move your child from trauma to triumph.